Hello everyone, my pleasure to be here today at ITNG Congress with participants from all over the world. I would like to share our project results titled Role of Information Technology in Patient Engagement in the few minutes that I have time to be with you all. Let me start my discussion with a fundamental question. Nowadays, particularly after COVID-19, almost all healthcare industry players claim patient-centeredness and patient engagement as a priority, a policy, or ongoing strategy. The question is how they approach the concept, how they understand it and lead patient engagement efforts, and what methods they apply to engage patients. We are going to reply the question through this presentation by an introduction to patient engagement and role of information technology in it, then showing a summary about the methods we use in our study, including the first phase of a study, that was a scoping review, and the second phase of that was model development. Then we will review findings of both phases and conclusions. You know better than me about the importance of patient education and patient empowerment. Those concepts entered the health industry around 1950. After those concepts, patient engagement has been introduced to the market to value, hear, and activate patients, not only to keep patients connected, but also to give them a responsible and active role to impact their individual health and population health outcomes in an organic and sustained communication. Having patients activated needs patients who are informed, patients who are motivated, and patients who are supported to take responsibility, make decisions when needed, and actively control the care. Any of industry players but interpreted the concepts by their available capacities. They addressed a range of patient engagement aspects like their available solutions, such as they started online scheduling of appointments and then called it patient engagement. They started interactive messaging in secure environment and called it patient engagement. They provided access to online health records or shared billing statements and called it patient engagement. But they paid less attention to patients' capacity to contribute to healthcare services, to design the research, like patients' contribution in subject selection of the research, or intervention designing and analysis with contribution of the patients and families. And also they paid less attention to patients' potential to improve product policy and design, service policy and design. Based on the facts we found in this review, understanding patient engagement is essential in the transformation, particularly by E.Health people who are in charge of technological solutions. In the short term, patient engagement helps health actors to do their daily workflows or achieve expected targets by payers through keeping patients connected and assisting them to be compliant with care processes. But in the mid-term and long-term, patient engagement improves the system performance, like enhancing patient experiences, or improving patient adherence and retainment, or bettering care quality and outcomes. And ultimately, patient engagement can save the costs and enhances the return on investment. IT platforms provided a great potential to enhance patients' engagement with passive or active involvement strategies. When we facilitate and shorten the time to access to paraclinical tests, lab results, for example, or send appointment reminders by text, or send an educational video to patients' mobile apps, we are using passive engagement mechanism. On a higher level of deliberate, when we ask patients how informed and confident are to take an important decision about chemotherapy or surgery, then we try to close the informational and emotional gaps in response, or when asking patients and families to share their views and experiences on how we can avoid the pain points, for people with similar conditions, we are trying a mature, active type of patient engagement. Our study objectives were first to highlight patient engagement approaches by key industry actors based on available evidences. Second, to develop a multi-actor model to cover the crucial dimensions of patient engagement and to optimize its planning and implementation. The method of this study was scoping review. And the study was conducted in 2020 in scientific databases like Google Scholar and PubMed. The study designed to identify gaps in evidence that are important to healthcare professionals and policymakers in regard with PE leadership. The research question was how stakeholders approach patient engagement. We used search keywords including patient engagement, patient participation, activation, involvement, and insights. After the careful setting of inclusion and exclusion criteria and reviewing relevant studies, out of 4,500 articles, we included 17 secondary reviews with more than a single stakeholder perspective on intervention. When we used the various stakeholders' views, particularly PE solution developers, to develop a multi-actor leadership model for patient engagement design and implementation. We reviewed the studies and classified approaches by stakeholder groups in 4 categories. First of all, e-health people, insurers, providers, and biotech companies. The perspectives of mentioned diverse players regarding PE were different, really different. The areas they looked into PE were in a range of benefits from cost saving to averted complications. Also, involvement strategies were defined as ranging from visit scheduling or filling a survey to interventions like consultation to design the operation room, for example, to design the operation room considering aspects that are essential to patients. Today, I want to focus more on e-health solution developers. Our review indicated that IT platforms facilitate communication and care coordination. In this way, they plan to close the gaps in quality. IT also has the capacity to provide actionable information, sometimes beyond information. It develops the insights, leading to more informed decisions by providers and patients. The important finding of our review is that solution developers mainly centered on routine data and operational processes, like visits, appointments, tests, bills, and reminders. Analytics dashboards also designed to use those type of data. This is why IT has the potential to provide meaningful insights for quality improvement, for smoothing the patient journey and patient care. Being a care facilitator, navigating transitional care services, processing billing transparency, or personalizing patient education, helping patients with pain management services, and many other initiatives that gives the patient the responsible role and an assistance to better the healthcare journey, to contribute to their care and make informed decisions. Some stakeholders believe in importance of choosing the right technology and proper regulation to achieve the best outcomes. But the other helpful finding of our study was the necessity of appropriate time share and its balancing between the patient direct FaceTime and EHR work, electronic health record working, that seemingly make distractions and complexities for clinical providers. Clinical providers also acknowledge PE in different levels. Shared decision-making for a given health situation is a micro-level engagement, while analysis of the patient surveys regarding how they received information followed by ultimate improvements could be classified in meso-level. From different angles, focus group discussions FGD with cancer survivors to share their views about how to redesign cancer pathways based on patients' experiential knowledge is a high-level engagement. We combined the stakeholders' perspectives and developed a conceptual framework. that is advisable to patient engagement by means of various actors, particularly data and technology partners. The model highlights key actors and interactions that influence patients' engagement. Fundamental point of this model is leading PE occurs in a complex system in which main actors are not only doctors and patients. Key actors are payer organizations, provider organizations, patients, and medical providers. In the secondary and invisible layers, pharmas and other suppliers, and policymakers. According to the model, IT platforms that claim PE as an essential advantage should cover the patient needs, first of all, like informational needs, decision inputs, sources for medical support, for mental health, health-related life quality, and financial support. Those are elements that patients are looking for in a well-designed engagement tools. The platform should allow the patient that live with a condition to express their need for support and their capacity to contribute to the careful design and improvements when it's needed. A transformative transcription of digital patient-centeredness would happen if patients keep their virtual rooms lifeline, then they allow changing insurers and changing providers to connect to a constant health profile for each patient. Now it is vice versa. When we buy a new healthcare policy and change our provider, the patient should apply for new application and turn around to adopt to new technologies and new care environment and platforms, something market-centered instead of patient-centered. As a summary, PE tools should transform the paternalistic industry approach to a flat partnership like other goods and services, that customers are determinant and valuable because in this situation only patients are the best health partners. In addition to e-health policies, patients and their partnership drivers and behaviors are important too. Engaged patients are the people who build the knowledge and accept accountability and control over the care. They are informed, confident, and quality demanding. Those patients are better partners in this model. The powerful influencer are insurers because there is where the money is. To maximize patient engagement, payers play a fundamental role since payment mechanisms shape the behaviors among providers. For example, right now, higher compensation for annual wellness visits has made it attractive and essential to physicians, or saved shared amount by CMS, Center for Medicaid and Medicare, is motivating accountable care organizations to plan for quality savings. The other impacting player is physician and clinical team. Through this study, we amplified that physicians' efforts for PE are a function of how they are trained, how they are supervised and paid. However, individual factors like personal traits and decision style influence their communication and interaction quality with patients. I should say, nothing is linear and simple with patient engagement because understanding and valuing the effect of all influencers are important to be able to develop an effective solution. As much as payers are important, the organizational systems that manage the dependent physicians are important. Imagine a hospital or accountable care organization that promotes patient engagement as a strategic priority and has a leadership guide for patient engagement and patient family advocacy program to improve the care. Then compare it with other delivery network that applies PE word in web pages, software, and social media only to keep patients in network through several reminders a day to remind unnecessary schedule appointments. In conclusion, existing patient engagement approaches are heterogeneous patchy, and conditional with different interests and understanding levels. Even patient organizations face gaps in understanding PE and has a long way to make it consistent with patient needs and expectations. Maybe because some of them originally are not representatives of the patients and are more affiliated with other beneficiary groups. But technology, as always, transcends the defective mechanisms and moves forward to meet the end users like any other industry. Patient engagement mechanisms should be centered on patient needs more than other stakeholders, or at least along with other stakeholders. Patients who live with a condition are reliable sources of experiential knowledge. We call it patient experience, helps us understand and close the care gaps. Now is the time to use the capacity of patients' insights and avoid over-rely on other available sources like directed speaker bureaus or traditional prescription leaders. Patient engagement is a dynamic and evolutionary process that would be built on multi-stakeholders interactions. We hope our model helps professionals advocate, lead, and develop patient engagement within and outside the organizations by a systems-based approach. We are ready at KPI, Key Patient Insights at North Carolina, to build partnership and coalitions with all who have the capacity to make a transformative impact in the industry, to improve patient engagement with a thorough understanding and design of PE systems and programs. Thank you so much for your attention and have a very nice time.